Good afternoon, everyone. As all we know, today is the World Heart Day, and we are having Dr. Subhendu Mohanty, who is the head of department and senior consultant of the cardiology in Sharda Hospital. Myself, Dr. Shresh Srivastav, will be having conversation on awareness, control, and treatment of the cardiovascular disease. Thank you, Dr. Mohanty, for joining us today. So, sir, before we start, I would like to introduce him. He has more than 22 years of experience in the field of cardiology, and he is pioneer of some very good cardiac techniques. And sir is currently working at the Sharda Hospital, Greater Noida, as a senior consultant in the Department of Cardiology. With over a decades of pertinent professional experience, he has published widely both domestic and foreign journals and has contributed numerous chapters in different books of cardiology. So, sir, most welcome with us. So, we will have some questions.
Yeah, sure.
So, Dr. Mohanty, please enlighten us, our audience, with some basic cardiovascular diseases and some of their prevention methods. What are the cardiac diseases and how we can prevent them?
The most common cardiac disease that we see in the general population, or rather I would say, which is recognized by the general population, is myocardial infarction, what we call as heart attacks. Now, heart attack is a very dangerous manifestation of a long-drawn process of cardiac illness, which when manifests can be life-threatening. We all know that, and if not treated in time, it can lead to death or else long-term problems in which the quality of life is significantly affected. So that is the most common disease that we are hearing about. And as far as prevention is concerned, yes, there are multiple measures which includes the diet and daily lifestyle measures which we have to take to prevent the problem of heart attack.
Alright, sir. Thank you so much. And is age a risk factor for the heart failure?
Yes, age is definitely a risk factor for not just heart failure, all types of heart diseases. As you grow older, the chances of heart disease increase. Now, there was a time 20 years from now, we never used to suspect a heart problem in somebody who used to present at the age of 40 or below. But with the changing lifestyle, the whole pattern has changed now. Now, it cannot be strictly said to be a disease of the elderly, because we are seeing very frequently in the young also. But yes, with increasing age, the chances of any heart disease, which includes heart attack, heart failure, stroke, atrial fibrillation, all of this they increase as age increases.
Okay, sir. So, what someone can do to decrease the risk of heart failure or heart attack or cardiac-related diseases?
Now, when it comes to cardiac-related disease, the risk factors broadly can be divided into modifiable and non-modifiable. Now, modifiable risk factors are the ones where you can do something about it and prevent heart disease. Non-modifiable is something which you cannot change. For example, your age, there is nothing that you can do about it. Gender, like males, they are more predisposed to heart disease than females. There is nothing that you can do about it. So they are non-modifiable causes. Now, coming to modifiable causes, the most important modifiable causes are, one is the control of hypertension and diabetes if somebody has that. Second, stopping smoking, especially tobacco use mainly, and among the tobacco use also, smoking is the most dangerous factor. So anybody who smokes even 1 or 2 cigarettes in a day has a high predisposition to develop heart attacks. Third comes our lifestyle. We have to decrease our mental stress and we have to increase our physical activity. Then comes our diet. The increased consumption of processed food and fat will lead to increased chance of heart disease. Now these are the modifiable risk factors on which we have to work.
So, sir, a lot of the patient comes with so many questions. So, one of them is, what is the difference between heart attack and cardiac failure? Because some of the people, they have some confusion between that, and they get panicked when they get any diagnosis from the medicine or your department that they has a cardiac failure, but they misconceptualize this with the MI.
You see, for the general public, there is always confusion between a heart attack, a cardiac arrest, and a heart failure.
Yes.
Now, cardiac arrest is totally different from heart attack. Cardiac arrest is not the same as heart attack. Similarly, heart failure is not the same as heart attack. Now, when we say heart attack, that basically means the technically myocardial infarction. That is the acute emergency. It's an emergency condition when a part of the heart is not being supplied blood. So one of the arteries gets blocked. Because of that, blood supply is stopped to the heart, and that leads to damage to the heart. That is heart attack. Heart failure is a condition where the functioning of the heart, that is the pumping of the heart, decreases. Now that can be because of multiple causes. Anybody who has developed heart attack earlier can develop heart failure. Similarly, there can be some infections because of this, there can be heart failure. So what heart failure means is that the decreased pumping function of the heart leads to heart failure. The primary symptom in this is patient developing breathlessness. Now, cardiac arrest is the third condition in which the heart totally stops working. In these two conditions, the heart doesn't stop working, but ultimately, if the heart attack is not treated or heart failure is not treated, then they develop cardiac arrest. That is the condition when the heart stops working. So that is cardiac arrest.
Alright, sir. So, who is at the highest risk for the congestive heart failure?
People who have high incidence of heart attacks or any risk factors which can precipitate heart attack, they are the ones which are at high risk of developing heart failure. Second, people who have got uncontrolled high blood pressure, they also develop heart failure. Third, people this can happen even in young, in which they develop some infection and which partly involves the heart also. Then that can also lead to heart failure.
Sir, does pacemaker have any role in the cases of heart failure?
It has, but not in all cases. Now, there are some selected criteria that a patient has to fulfill for the pacemaker therapy to work in. So, only if those changes are there, now that is a technical part, and it is actually the most important part when it comes to decision making. Putting a pacemaker is easy, but whom to put a pacemaker, that decision is very important. So there are some selected criteria which we see in the echo and the ECG, based on which only we advise pacemaker therapy for heart failure.
So today we are seeing young people, they are coming with the myocardial infarctions, heart attack. So sir, can you enlighten us about the risk factors, what can cause the MI in young patients?
If I tell you 5 or 7 factors, you will not remember even one. So only 2 factors which are important. Most important, smoking. Second, work-life balance. Now the work-life balance includes a lot of things, which includes mental stress, how much time you are giving to yourself and your family, how much time you are giving for exercise, and how much time you are putting into your work. So that basically summarizes the most important factors: smoking, work-life balance. No third thing to remember.
Thank you so much, sir. And is there any relation between genetics and cardiac diseases?
The people who have a family history of cardiac disease, they have an increased predisposition to develop heart disease. So by predisposition, it means that they have increased chance. It is not that they will develop, but yes, compared to a normal person or a person who doesn't have a history of heart attack, they have a higher chance of developing heart problems.
Alright, one more question I would like to ask you. Sir, there is one question, and we can say it's a taboo about the stenting. So if generally we see lot of people, when we prescribe them or we suggest them to go for the stenting, they generally think it's not necessary. Doctors are like just prescribing like anything. So sir, can you tell us the reason why the stenting is important in the cases of MI and how it can be preventive?
So again, like I said, for pacemaker and heart failure, the same is the case for stenting when it comes to blockages. Now, where to put the stent is a very important factor. Now, if the stents are used in places where they are not needed, then obviously they will not work. So there are some instances where a misjudgment, because of misjudgment or any other thing, stents have been used and then they have not worked in the expected way, because of which there has been a perception in the general public that stenting doesn't work. But that is not the case. It is life-saving. What is important is the decision. The decision of when to put a stent and when not to put a stent is very important. And stent wherever needed is absolutely necessary and it is life-saving. There is absolutely no confusion about that. And there are numerous data now of more than 25 to 30 years data which have clearly shown the superiority of stents, especially in patients with heart attack.
Alright, sir. So, any precaution the patient should take after the stenting? Any lifestyle modification or related to the medicines prescribed to them?
Yes, it is very important, especially because after putting stents, the blood thinners are the most important medicines. So people should not stop their blood thinners and the medicines which they are taking. And second thing, lifestyle measures are very important because once you have put a stent, doesn't mean that you cannot develop blockage again. So if your lifestyle changes are not done, then you can again develop blockages in the heart where more stents will be needed or bypass will be needed. So lifestyle measures are important and taking medicines regularly, that is also very important.
And as you said, sir, work-life balance is very much important factor to prevent the cardiac diseases. So, what are the some physical exercises can you suggest us to prevent from the cardiac diseases?
Simple walking. You don't have to join a gym. You don't have to do anything. You have to walk every day for half an hour to 45 minutes. Not even every day, 5 days in a week with slightly fast pace. That's all. Not a very docile, lazy walk. Slightly fast pace. 30 to 45 minutes in a day. That is what is needed. And if you want to do more, if you want to do better, you can do cycling. You can do some cross trainer, swimming. You can play any sport. That is the best way. Badminton, basketball, whatever you can play. That is all that is needed. You don't have to join a gym. You don't have to do any special exercises. All it needs is non-weight bearing exercises. So where you don't have to take on heavy weights. That's all. Yes.
So, as we can see nowadays, the latest technologies are coming in the field of cardiology. So, what are the latest and prominent facilities we have in the Sharda hospital, in the department of cardiology?
So, Sharda Hospital, we are probably the only hospital which caters to all types of heart diseases. There are not many hospitals which have this type of facility, and we have the best of the cath labs, and we have a team and which caters to everything from structural heart disease to heart attacks to electrophysiology to pacemaker implantation. Everything is done. Even recently, in fact today also, we did a case in which it was a case of heart failure with heart function of only 15 to 20%, and we put a pacemaker for them. And few days back we did a case in which the valve was narrowed down and we had to do a balloon surgery. So we do a variety of cases here, and we have one of the best cath labs and a very good team which takes care of all the patients.
Sir, can you share a few words on the World Heart Day, especially for the younger people?
World Heart Day, I want to convey this message that you don't have to be scared about heart diseases, and yes, you need to be cautious about it. You need to take precautions, but fearing that you are going to develop a heart disease is not going to stop it. So you have to focus on your work-life balance, and you have to focus on your exercise, on your diet, your physical activity, and your stress levels. So that is very important. If you maintain a normal lifestyle, you don't have to take any special precaution to take care of your heart. The problem of heart disease comes only when we neglect it to a very large extent. So that is why you don't have to worry about your heart as long as you are having a normal lifestyle.
Sir, thank you so much for sharing your valuable views on the cardiac diseases, and we would like to take some questions from viewers. So we have a question from Niharika Jain. What are the signs of heart failure?
Heart failure, the most common presentation is with difficulty in breathing and fatigue, that is tiredness. So these two are the most important symptoms or signs of heart failure. So if somebody develops a breathing difficulty with minimal walking or like climbing a few stairs, or else who feels that he has got a lot of fatigue, tiredness and is not able to walk, then there can be signs of heart failure.
So some of the people ask, sir, any swelling or bilateral pedal edema, is it always related to the heart failure, or it could be some other causes related to that, sir?
No, you are a specialist in this. So it is just that you have to ask the question. So I am answering. Otherwise, you obviously know about it. That swelling is not synonymous with heart failure.
Okay.
Swelling can be because of kidney disease, can be liver disease, it can be thyroid problem, it can be heart problem. So swelling is just one sign which basically leads us to think of a lot of wide disease problems. So the best person to attend or evaluate for swelling is actually the general medicine people who can evaluate and find out what the problem is.
So lots of viewers are with us. So we are going to take one more question from Preeti Gupta. What is the minor heart attack?
Minor heart, there is no technical term like minor heart attack. There is a common term, it's like used by the people in general population. So you cannot define minor heart attack because as such there is nothing like a minor heart attack. Any heart attack can cause death, but the way if you have to describe it as a minor or major heart attack, then I can say that in patients who have a heart attack but which does not lead to a serious damage of the heart, that can be termed as a minor heart attack. And a heart attack which has led to a severe damage of the heart can be termed as a major heart attack. But what is important is both can lead to death. Yes, the one which we call as, which we are saying as major heart attack, that is heart damage, it has a higher chances of causing death than the other.
Alright. So we have one question from Rajiv Singh. Can we test heart attack at home?
It is better not to. Yes, you can, but I would suggest that if you are not a medical person, you should not take chance with a heart attack. It is always better to go to the hospital and do it because unless you have done an ECG, there is no way to rule in or rule out a heart attack.
So sir, what could be the common signs and symptoms related to the heart attack which can a person assess to their home?
Most common sign or symptoms is what people think is gas. So gas is actually no medical terminology, but that is how general population describes it. So basically, what I understand from people when they say gas is that they have some discomfort over this area, sort of bloating sensation, sort of burning sensation. Now these are also the symptoms of heart attack. So whenever you have these type of symptoms or chest pain or pain in the throat or arm, any discomfort which is persistent, which lasts for more than 5 to 7 minutes, and if you, especially if you have some risk factors like diabetes, hypertension, smoking, mental stress, then you definitely should rule out heart problem in such cases.
Okay, sir. One viewer, Nikun Sabarwal, is asking, how do I know if it's a heart attack or a gas?
You will have to see your doctor. It is not easy. I would never take a chance in this, and I would never advise anybody to take a chance on this. Even after 15 years or 20 years of experience, even doctors, many times they have to do multiple ECGs, blood tests to be sure about heart attacks. So there is no way you can understand whether it is heart attack or not at home. So wherever you feel that the problem is significant, go to the hospital for the simple reason that heart attack can be life-threatening. It's just not worth taking the chance.
Mr. Amit Singh, he has asked, cardiac arrest and cardiac attack or heart attack are same?
No, I just mentioned that the cardiac arrest and heart attack are not the same. Heart attack is when there is a sudden blockage of an artery leading to decreased blood supply to a part of the heart. So your heart is working, but it is at risk of suddenly stopping and it has got damage. Now, cardiac arrest is when the heart stops working. So, cardiac arrest is the next step of heart attack. If it is not managed, then it can lead to cardiac arrest. Cardiac arrest is the stage where the heart stops working, where it basically means that the person is dead within 2 to 3 minutes unless you do a cardiopulmonary resuscitation.
There is one more viewer, Suchi Kashyap. Sir, does walking make heart stronger?
There is no strong or weak heart. Heart is one organ which functions the same way right from the birth to the time of death. It is not that with age the functioning of the heart decreases. So nothing makes the heart strong. But yes, walking and all, it helps in preventing heart attacks. So that is a way, that basically exercise, just like we said, exercises can prevent heart attack. It is just that.
So one more question, sir. Anuj Seth, what is heart block? He is asking what is heart block.
Heart block depends on what has been explained to you, because this is not a scientific term. So scientifically we don't say anything as heart block. Now blockage in the heart can be at the level of arteries, in which case we call it as heart attack. or else it can be in the electrical system of the heart, in which case we need a pacemaker. So these are the different types of blockage which can happen in the heart. Blockage is not a terminology that is used scientifically. So that is a terminology which we use to explain to patients so that they can understand it easily. So it can be level at the artery or else it can be at the electrical part.
Ranveer Singh is asking, myth or fact, chest pain in the left side. Means this left side
Fact.
chest pain is always associated with the...
Not always. Nothing is always
MI
associated.
or-
No. Nothing is always associated, but yes, left side chest pain, if it is there, it is not a myth that it can be heart attack. Yes. Left side chest pain should be taken seriously.
It's a matter of concern.
Concern.
Nishant Tyagi is asking, what is the best test to check for the heart problems?
There is no one test by which you can check the heart problem. It depends on what type of problem we are suspecting. If it is an electrical problem, then we have to do a Holter test or electrophysiology study. If we are thinking of a blockage in the heart, then we have to do an angiography or a treadmill test. And so there are different tests depending on what type of disease you are thinking. Heart disease is not localized to one or two illnesses. There is a wide variety of heart diseases, and based on what your problem can be, we decide on the investigations. The most common investigations which usually solve most of the doubts are the ECG, echo, TMT and Holter.
Okay, sir. One question is, can a stress test show a heart attack? Asked by the Snigdha Roy. So,
Stress test is not the one for heart
Stress
attack.
test. Yes.
Stress test is when we don't. Heart attack is an emergency, so we don't give any further stress whenever there is an emergency. So heart attack is diagnosed by ECG or a blood test by what we call as troponin I or angiography. Stress test is when there is no heart attack, but we want to see if there is blockage or not. So before any heart attack comes, so that is stress test. That is done in stable people without any emergency.
all right. Mr. Asutosh is asking, can gastric issues cause heart attack?
Gastric issues per se are not directly related to heart attack. People get confused, like I said, they think that the gas sort of thing is causing their heart problem. That is not the case. The thing which they were perceiving as gas must have been actually a heart problem.
There is some, I think, weird question from Mohit Gautam. Is heart failure is a death sentence? So,
Heart failure is not a death sentence because it is not that heart failure is not curable.
yes.
There are many patients, in fact many patients who fully recover from heart failure also, and many patients who are eligible for a pacemaker implantation in heart failure, they show very marked improvement when a pacemaker is put. But overall, if you see, out of 100 patients, 50 to 60% of the patients may not show significant improvement, but we can alleviate their symptoms and improve the quality of life with the medicines so that they can have a normal life.
And Gitika is asking, is heart diseases inherited from mother or father?
Yes, there is an increased chance of heart disease if your mother or father have a heart problem.
All right, sir. Thank you
We
so
have
much
more.
for elaborating all common questions. And between that, I would like to ask some other questions which we see or which we get in the OPD basis. Sometimes patient comes with the pinpoint chest pain and they ask for the ECG or they get panic that definitely I have a heart attack. So there is any particular pattern of chest pain in the heart attack or left-sided chest pain?
Yes, there is a pattern of heart attack which is typical. So when you have that typical type of chest pain, then we are more or less sure that this is a heart attack. But if it is not typical, it cannot be totally ruled out. Especially patients who have long-term diabetes in females, they can have very atypical chest pain. In fact, somebody can just point with a pinpoint chest pain and still can have heart attack. So in patients who have risk factors, it's better never to take a chance, because if they have risk factors like diabetes, hypertension and all, they can have atypical chest pain also. So in those patients, it's always better to get an ECG done. Now people without risk factors with a very low probability of developing heart attack, in those patients, atypical pain can be managed without further investigations for heart disease.
So can you tell me who are the cluster of the patients should always go for the regular heart checkups? Or I can just simplify that. So the patient with what kind of comorbidity should go for the regular heart checkups? And above what age a patient should go for the regular heart checkups?
So the standard recommendation is after the age of 40, everybody should undergo a periodic heart checkup. That is one. Now, other than this, people who have risk factors, they have to undergo periodic heart checkup even before the age of 40. So these risk factors include high blood pressure, diabetes, history of smoking, high cholesterol, strong family history of heart diseases, and people, I would add on this, people with high mental stress. So these people definitely should undergo periodic
heart checkups. Mr. Nishant Tyagi is asking, what procedure does doctors at Sharda hospital for the take care of heart patients?
Every procedure is done here. Like I said, we do everything from angioplasty, angiogram, pacemaker implantation, valve diseases, electrophysiology, everything. So in our center, we cater to the widest variety possible, including the brain artery stenting, the lower limb, the leg artery stenting. Everything is done at Sharda Hospital.
Mr. Piyush is asking which gender has more heart attack?
Males.
Males. And Mr. Prateek is asking, can a healthy person have a heart attack?
Anybody can have a heart attack. You see, it is just like saying, can somebody driving safe have an accident on the road? Yes, he can have. But the chances are less. Probability is low. So heart attack is also something similar. It is not that somebody who is totally healthy cannot have a heart attack, but the probability is very low. So yes, anybody can have a heart attack, but it all depends. The probability of developing heart attack depends on how you maintain yourself. If you have high risk factors and if you are not maintaining your heart well, then the probability becomes high.
Okay, sir. One more question. As you said, the work-life balance, or we should go for a regular exercise. So, would you like to suggest to the young people or people who are going to the gym and they are start doing additional exercises? So, most of the people, they are coming with the sudden heart attack, cardiac arrest. So, can you give some suggestion to them, sir?
I think people are looking at shortcuts. You see, they are not doing regular exercises and then they want suddenly to get into the gym and do the maximum possible exercise. That is what leads to a problem. So even if you want to join a gym, you have to start very gradually. As far as the heart is concerned, you should focus on non-weight bearing exercises that I am repeating again. That you shouldn't be directly going and doing bench presses and all with 60 kilos, 50 kilos. That is not the way to do. You have to do cardio exercises, which includes treadmill test, then cycling, and then cross trainer. Do all these things, build up your stamina, and after that you can take small weights and slowly go about it. So suddenly when people join gym and start to do heavy exercises, and then they start taking supplements which are not certified, that is when the problems occur.
One more question from our viewer. Asad Abbas, he is asking, my triglycerides is 354. I am taking Resel F10. Is it okay, sir?
We cannot treat you on the Facebook Live. You have to go and see one of your doctors. That is not the way to do. I can give you, I can tell you that yes, if you have high triglycerides, you need to take medicines. What dose, which medicine depends on your age, your triglyceride levels, your other risk factors. It is not easy to prescribe a medicine based on just a triglyceride value.
So I would like to simplify this for Mr. Asad Abbas. And is there any relation between the triglyceride and cholesterol level with the cardiac diseases?
Yes, triglycerides, persistently high triglycerides can also lead to heart problems. But triglycerides are not as major a factor as the LDL. It is the LDL cholesterol which is the most dangerous one. High LDL cholesterol and low HDL cholesterol are the more important risk factors than triglycerides.
Ms. Neha, importance of CPR for general public if someone witnessed the heart attack in a public places?
CPR is something which people have to learn, but it is not as casual that you can just start doing it immediately. What you have to understand is when you are doing CPR, you are pressing onto the chest with a significant force to almost do to maintain artificial circulation. So most of the patients, especially the ones with the elderly, they develop fractures over the chest. That is a common thing because you almost break the bones when you are doing this in the elderly. So don't just jump into CPR unless you are well trained. Yes, the general public should be trained in CPR. It can be life-saving, especially in emergency situations. But it is not just enough to do some YouTube sessions and start jumping onto doing CPR on people unless you are well trained in that.
Alright, sir. So I would like to take one last question. Sir, what is the basic difference between a CPR or any cardiac techniques which are showing in the YouTubes, or we can say the role of Facebook or YouTube channels in preventing the cardiac diseases, as we are seeing a lot of people coming with the fake IDs and they are just showing us or wrong knowledge about the cardiac diseases. So what are the messages for them, sir?
You see, learning CPR is very important, I would say, and the general public should be taught about it. And the way to go about it will be to start it right from the school level. Children starting from the class 11, 12 itself, they can be taught what it is and how it is to be done at the school. And when they have multiple sessions, it is not very difficult. When they have multiple sessions, they would learn. And usually how we teach students is we use a dummy and we let them practice over it. So unless you have done that properly, it is very, very unlikely that you will be able to do it properly just by watching the YouTube videos. Now social media is a double-edged weapon which has to be used properly. There is a lot of misinformation, there is a lot of information also. Now how to filter that depends on an individual person. Nobody can say that how you have to filter that, but yes, it is a source of information as well as misinformation. So it is very important for you to look at the person from whom you are taking your knowledge and check his background as to whether he is qualified enough to say what he is saying.
So thank you, Dr. Mohanty, for sharing this information with us, and we hope all our viewers enjoyed this session and stay tuned for such live sessions. Thank you.
Thank you.